Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can always text your questions. This one is a follow-up question to when we were talking about blood donation. This person is asking, do people get tested for coronavirus before donating blood or plasma?
They don't. And when giving blood or plasma, platelets, all of us who have done that realize there's a long screening list of questions that have to be answered before donating. In addition, vital signs are checked. And so the screening process would really rule out people who have coronavirus. That's the idea. I will make a plea again that blood supply is low. It's important that hospitals, health systems have access to appropriate blood supply. So please donate blood. Red Cross is a great place. Cone Health uses an organization called One Blood. Call them, make an appointment. It's critical for patients who have coronavirus.
This text question is, I have come into direct contact with someone with the virus and have quarantined myself for 72 hours so far. Is that enough?
72 hours isn't enough. And so we know that people can get sick anywhere between 3 and 14 days after coming into contact with someone with coronavirus. And so the recommendation is quarantine yourself for 14 days after coming in direct contact with someone who has COVID.
This next text question deals with the number of cases, the number of positive cases going up, and we're hearing there's more testing happening. Does that mean I should not be alarmed with the rise in case numbers?
Yeah, I don't think there's no reason to get overly alarmed based on the absolute number of folks who test positive for coronavirus. Looking at the relative number of people who have coronavirus compared to the number of tests done might make some sense. So look at the ratio, the rate of infection, as opposed to how many people really have it.
Someone is asking, they're asking, how often should you be washing your cloth masks when you use them?
Yeah, I think cloth masks used out in public, if you're wearing it in the grocery store, I'd have enough where they really ought to be washed every day.
Especially if you're using them every day, you should wash them every day. This next question says, I recently read that people who have had the flu vaccine within the last 5 years will test positive for COVID. Is that correct?
I haven't heard that. I would say it's incorrect. They're different viruses. There wouldn't be any cross-reactivity between the virus that causes influenza and coronavirus.
This next question surely comes after everything that the governor was talking about over the weekend with churches. Is it safe to go to church if they're planning to host fellowship events outside?
Good question. I would recommend, I understand the desire to socialize and be together, especially for worship. Being outside is great, but it's also has to be in a very socially distant way. Is be more than 6 feet away from each other. Don't hug people. Wear your mask. And the key is to stay away from people.
This person is asking, I'm a senior and I miss my grandchildren a lot. Is it safe for them to come over and see me?
That's a tough one. And so children, we all know, can have coronavirus. They're not as likely to become severely ill with coronavirus as their grandparents. And so again, I think there are ways to see your grandchildren safely. It won't be as fun as it used to be because they really should stay away from you. You shouldn't hug all over them, and everybody should be wearing a mask, but they have to stay away from you.
Are children any more infectious than adults?
We don't think they're any more infectious. They're not any less infectious either. And we think they're more likely to not have symptoms, or at least the classic symptoms. So a 4-year-old could feel perfectly fine, lots of energy, and be able to transmit the disease at the same time.
as so many other things change, symptoms, that kind of thing, this person is asking, any idea when you think the virus could peak?
Could peak?
Yes.
Yeah, we used to use the word peak a lot at Cone Health, and we are now avoiding that term because we think we're in for a long plateau and that we're going to be seeing coronavirus for months to come. And in some ways, that's good, is that maybe we really have flattened the curve. And so we're seeing this long plateau as opposed to a quick peak that would have overwhelmed our communities and health system. I think the key to ending coronavirus will either be effective treatment, really effective treatment, or more likely a vaccine.
All right. Thank you so much for your time and your expertise. Thank you for your questions.